Good evening, coming to you live from ZTN Studios in Harare, Zimbabwe. Welcome to United Nations at 75 Dialogue, shaping our future together. Coronavirus, COVID-19. Is Zimbabwe ready? That's a big question we're asking today. Now, this is the third in a series of roundtable discussions examining the United Nations Sustainable Development Goals, a shared vision to end poverty, rescue the planet, and of course, build a peaceful world. Health is a fundamental human right and a key indicator of sustainable development. Poor health threatens the rights of children to education, limits economic opportunities, and increases poverty within communities and countries around the world. Tonight, our focus is on SDG 3, which seeks to ensure healthy lives and promoting well-being for all at all ages. Now, we pay attention to the coronavirus COVID-19 outbreak, which is now a global pandemic affecting hundreds of thousands and killing tens of thousands in over 166 countries. Now, we would like to thank our partner, the United Nations in Zimbabwe, and also acknowledge our broadcast partners, Herald Online, A Star FM, Capitalk FM, and Nyami Nyami FM, Diamond FM, and our Voice of America that will be rebroadcasting this to over 80 channels globally. Now, to our viewers and listeners, we would love to hear from you. Join this discussion on our Twitter handle, that's at ZTN News, and also on our Facebook page, that's Zimpapers TV Network. Also like to invite you to visit un75.online to participate in a 1-minute survey that is there and also make your contribution. Now, good evening. I'm Blessing Munatsi. Tonight, we would like to look at SDG 3 in light of the ongoing COVID-19 outbreak. And to our esteemed panelists, we kindly ask that you respond within the allotted 2 minutes of making your submissions. We also kindly ask that each of our panelists briefly introduce themselves to our audience. Starting with you, ma'am.
Thank you very much, Blessing. I'm Monica Mutsvangwa. I'm the Minister of Information, Publicity and Broadcasting Services. Our job as a ministry, our mandate is to make sure that we give people information. Access to information is a right enshrined in the Constitution of this country. Section 61 and 62 talks to that effect. And as a ministry, we are doing everything in terms of making sure that this COVID-19, which is the biggest crisis in the whole world, so that people in this country are aware and how they can actually preserve themselves, precautions to make sure that we save lives of our people. So a lot of information, a lot of communication. There's a lot of communications which we are already doing, and there's much more we will continue doing.
Definitely. Thank you so much, and welcome to the program.
Thank you.
Sir.
I'm Dr. Obadiah Moyo, and I'm the Minister of Health and Child Care for Zimbabwe. As a ministry, we are the frontline ministry as far as COVID-19 is concerned. And we have received some support, from some of our international donors, including the United Nations. So, we are making sure that we look after our staff. Our staff are the most important to us. They are the ones we should be looking at because they are the ones who work with the sick. We do not want to end up with sick staff. So we're making sure that we get them all the protective gear, just like we saw what was happening in other countries, in China specifically, well protected so that they can be able to save the nation. So really, my main theme is on promoting the capability of our staff in ensuring that we get over this COVID-19 as we proceed.
Thank you so much, Dr. Moyo. Welcome to the program.
Thank you.
Now, COVID-19, the first case, of course, was registered on 31st of December. By the 11th of February, the WHO had christened this virus COVID-19, like we call it today, declared an international emergency by the WHO. And so far to date, 372,000 people globally have been affected, with more than 16,000 deaths. That's at least 4% mortality rate. Now, one of the SDGs for SDG 3, one of the targets is strengthening capacity, early warning, risk reduction, and management of global health risk. Minister Moyo, what is Zimbabwe's plan to effectively deal with COVID-19?
Well, as Zimbabwe, we are a developing nation. And number two, our economy is not as strong as the Western world or even as China. So you can see that, with the coming in of this disease, it will mean that we need a lot of financial support to be able to prop up our system and be able to effectively deliver the service that is required, and to be able to stop the spread of the virus and to be able to conquer the virus in the end. So Zimbabwe, we have our national preparedness plan and response plan. That has kicked in. It was actually launched by His Excellency, the President of the Republic of Zimbabwe, last week. And so far, we also have the interministerial task force, which was also announced yesterday by His Excellency. We find that these task forces and the National Preparedness and Response Plan Committee or Task Force are working very well. We had our first meeting today of the Interministerial Task Force, and it went on very well, and we've come up with all the various strategies that we have to follow.
I think we'll touch on the task force a little bit later, but a number of cocktail solutions that the Honourable Minister of Health is highlighting there, Minister Mutsvangwa. Looking at Zimbabwe's plan, how far are we integrating our plans with the World Health Organizations?
Let me first of all say, as a communication ministry, we've taken it upon ourselves to always disclose so that we earn the trust of our nation whenever we are in a crisis. You are aware Zimbabwe was faced by another calamity, the cyclone Idai, last year in March. And what we saw and what we learned from that is it's important to have communicate truthfully and be transparent so that you get the trust of our nation on board. This is, we are taking it very seriously. This is a crisis. We need each and every Zimbabwean to be aware of the threat which is with us. Not just Zimbabwe, but the whole world. It's a global calamity, global pandemic. And as a Ministry of Communication, we will continue taking information from World Health Organization and also from other countries, because there are other countries who have gone through this, and good news is coming from China, that at least they are not getting much new cases. So this is actually very promising, and so we are actually learning a lot from all those other countries. And as a developing country, obviously, in terms of resources, we wouldn't be comparing ourselves with those big nations. But as a small country, we have to talk to the rightful people. Make sure the message goes down to all parts of the 10 provinces of this country. We need to save life. One life lost is not acceptable. We need to save life for our people, and we can actually save life. So this is precisely why the President of this country, His Excellency, Comrade Idi Mnangagwa, came up with this task force, which the Minister of Health himself is chairing. And we're looking at all possibilities to make sure that we get the information right to the people. We want the trust of all our Zimbabweans. We also want rightful information. The oncoming of the new media, which is the social media, Twitter, Instagram, Facebook, we are appealing to each and every Zimbabwean out there, or anybody for that matter, to be truthful when you are reporting about such a calamity. It is not good for our people to panic. What is important now is to face head-on with this calamity.
The challenge that we have as a nation.
And so that we deal with it.
Dr. Moyo, Minister Mutsvangwa raises the issue of trust. And trust is mutual. It is very important. Does the country have adequate resources to successfully implement the plan that you mentioned? I know it's founded on 8 main pillars.
Yes. Zimbabwe continues to look for support. I have to be honest, we continue to look for support, but what we have put in place in our preparedness, is first of all to establish a testing system, because that is the most critical. We must be able to test and confirm whether someone has got the disease or not, and be able to come up with a proper statistic. So as far as testing is concerned, what we would really want to have is a system where we have the rapid testing scheme, right, which takes about 15 minutes, and then you get your result. If you come out positive, then you upgrade to another testing scheme, which is the confirmatory testing scheme, what we call the polymerase chain reaction, which deals with the DNA or RNA of a particular specimen which would have been taken from an individual. It is the gold standard. That test is the gold standard. If it comes out positive, you are positive. If it's negative, you are negative. However, that test takes 5 hours, and that is the type of test that we currently have in Zimbabwe. Mm-hmm. We are, however, awaiting, to receive some of these test kits which are rapid, which will be able to give us the rapid results. And once we have the rapid test kits, we'll be able to distribute them right through the country and be able to call for people to have their tests, to check themselves out, mm-hmm. And if they find that they're positive, then we upgrade, escalate to the golden standard 5-hour test. That's just one mm-hmm. of the issues mm-hmm. in terms of preparedness. Mm-hmm. There are several other issues that we have put in place mm-hmm. in terms of preparedness. The next issue is that of the isolation facilities. Isolation facilities at the moment, mm-hmm. we have the Wilkins Hospital, and in Harare and in Bulawayo.
We've got the Thorn Group.
I think
we'll come to that very shortly. I think the issue of resources, I went through the plan and I noticed that we've got a request of about 26 million US dollars to get the whole plan through. How are we financing this in terms of the budget? What has been allocated by government?
Well, in actual fact, it has gone up. Mm-hmm. This afternoon we were talking of 70 million US dollars, but it has actually gone up. We checked on the other parameters, which had to be included. It's now gone up to 100 million. Mm-hmm. Yes, 100 million US dollars. Mm-hmm.
Minister Mutsvangwa, maybe you wanted to comment on that?
I just wanted to say, in this task force, the Minister of Finance is also a member of this task force. Mm-hmm. And I think to make sure that we make every Zimbabwean rally on board, we need quite a substantial amount of money mm-hmm. to make sure that information gets to everybody, to make sure that we have enough isolation places, and this social distancing information needs to be really put everywhere, on TV, on radio, and you know that certain areas in our country have not been able to receive signal. So we are making sure in those areas we put posters, pamphlets, and also we use our system, local government system.
To make sure that the message goes there.
Yes, our traditional leaders, our religious leaders, all those will be involved.
Did the Minister of Finance maybe highlight how much is being allocated by government to finance this, or maybe how we're going to finance it as a country?
Well, as the Minister of Health, we all depend on the budget they are putting up together. As a Ministry of Communication, we have also put up our budget, and we've actually been receiving quite positive response in terms of making sure that the information about COVID-19 gets to the people. We need to save the lives of our people. Any government is concerned about the lives of its own people, and that's precisely what the government of Zimbabwe is doing to make sure that our people are saved from this COVID-19.
Honourable Minister, looking...
In fact, just to add on, as soon as the President announced he also announced the fact that he gave an instruction that more money should also be outlaid, from our Ministry of Finance, which is very good. That will help us a lot, when we go out and seek for more funds from our international partners. They will see that, locally we've also made a contribution. So the Minister of Finance is seized with that. And at our task force this afternoon, he clearly pointed out, that they will try and they will meet the budget, and there is further organizations for bringing out more money, getting more money from other sources, from other well-wishers. I want to hasten to indicate that we've had a lot of response already from the private sector.
Which is quite encouraging.
Yes.
I just wanted to find out from you, Honourable Minister, from 26 million going up to 70 million, looking at the strategy of the World Health Organization in dealing with COVID, it's mainly identification, surveillance, and also containment. Of those three, where is most of the money going into?
Yeah, we're looking at supplies, mostly supplies. We need the products, for being able to buy. We need money to be able to buy the safety products, the personal protection equipment. We need money for ventilators, and all that, and the test kits themselves. It's going to be a continuous exercise. So the clinical management of the patient takes a lot of money. The infrastructure will take quite a big chunk as well, but the majority of the money, to answer you specifically, will go into the test equipment and the clinical management requirements, for the patients. That is the key issue.
Okay, you mentioned the issue of infrastructure. Minister Mutsvangwa, coming to you. Obviously, as government, do we have any plans to increase the number of, COVID handling facilities, and also the diagnostic capacity of increasing the number of labs maybe that can do tests?
Actually, this afternoon, it was very encouraging news coming from even the institutions, universities. They are actually prepared to build temporary isolation facilities, makeshift ones, which will certainly take a lot of people, because we want to make sure that if there is a case in Guruwe, for example, let there be a makeshift isolation place there where they can start dealing with that patient there rather than always rush to Harare or to Bulawayo. So this is what is going to be happening.
From a logistical point of view, it obviously makes a difference. Minister Moyo, the people obviously need this clarity. There have been reports that Wilkins is inadequately resourced. Is this an accurate position, and do we have plans to improve?
Definitely. Let me explain to you the situation at Wilkins and what happened and all that. Wilkins is a seat of Harare Hospital. However, due to the fact that, it's one of the two hospitals in Harare for isolation purposes, government decided that since we have this epidemic or pandemic, it was chosen to be the main isolation hospital. Right?
It's designed to host infectious diseases.
Infectious diseases. You just can't go into any hospital and try and set up an infectious unit, because it takes a lot. I'll explain to you later. So with regards to Wilkins, it was refurbished, using local funds, and the Chinese government, the embassy, came forward and they offered to further refurbish and bring it up to an international standard. And in actual fact, when you visit soon, you'll see that, there's been quite a lot of improvement. So they decided to come in and make sure that the facilities has got ablution blocks, everything, sinks, running water, power, everything, air conditioning, which is very, very necessary. So they put up a good facility, and they're going to finalize that upgrade by Friday. You know, they should be done. I was speaking to the ambassador today, and he promised that they will be done by Friday. You know, so in the meantime, all the patients who've been coming in, instead of having to use the upgraded area, which was also visited by the Parliamentary Portfolio Committee on Health. If you remember, they visited that facility and they indicated that they were very happy with the facility. You know, so that facility, before even the upgrade of the Chinese, was quite good. And we also had an area where we had a room where we had reserved, you know, for the intensive care, where we would have the ventilators, monitors, defibrillators.
Do we have the ventilators there?
We now have, yes. We can talk about that.
And how many patients maybe can we take at
No, hold on. We have not yet finalized. You know, the Chinese are going to finalize the wards plus the ICU unit. Once that is finalized by Friday, we'll be able to have, you know, the ventilators, respirators being installed in there. So at the moment, they're having to use another section of the hospital, you know, which is not as good as what we would want it to be. But however, because of the fact that the patients had to come, you know, they had to find somewhere to put them.
Now, Minister, you wanted to add something?
I just wanted to add to say this is a crisis. It's not like Zimbabwe was ready to handle this. Like the whole world, I mean, this is not it's not a crisis for Zimbabwe alone. But what the Ministry of Health, which we depend heavily on in terms of information, they are working very closely. Also with they are partnering with private sector hospitals, because we need every Zimbabwean to get on board. We need all our hands to be on the deck. This is a crisis which is calling for even private companies in this country. And I'm happy to say we are already having very positive response, the kind of response which we got when we were confronted by that calamity, Cyclone Idai, where development partners, private companies are coming on board, because it requires all of us to look into this problem to save life.
Now, the special...
Let me add on that. You know, in order to increase the number of facilities, you know, at the moment in Harare, we are looking at St. Anne's Hospital. We are looking at another hospital, Arundel Hospital in Mount Pleasant. You know, in Bulawayo, we are looking at Ekusileni Hospital, which is lying idle. You know, and in most of the provinces, let's start with Vic Falls. Vic Falls, where the first case was, the whole community there, they've come together and they've decided that, you know, they will put up, you know, an isolation unit.
What are the timelines to roll out?
Which is good. You know, we just discussed about it and we set up a committee. The committee is going to work out the logistics and we want it done as soon as possible. You know, we don't want to leave, you know, things until late. So phase one was the main hospitals, I mean the main cities, Harare and Bulawayo, right? And then now we are going to roll out the plan into the provinces, so that at each and every, within each and every district, we'll have a facility nearby. And so that is what our infrastructure committee is going to be looking at, so that we roll it out. And like Honorable Mutsvangwa has indicated, we've had a lot of private companies who have come forward. You know, the issue I'm talking about regarding St. Anne's Hospital and Arundel Hospital, this is the private companies who want to assist us, and they're coming in a big way.
Minister Mutsvangwa, now, what are the measures that have been put in place to ensure that a Zimbabwean in the less developed parts of the country actually receives this risk information associated with the coronavirus?
As I said, information is power, and prevention is better than cure. And we know that we have got chiefs, headmen, all around the country. And we have the database. The Ministry of Local Government do have that database. In fact, most of our headmen, our chiefs, they are paid through mobile money. So it means we do have the database of sending information all around, all the way down to the grassroots. And of course, those who have access to radio, to television, we are sending that information, and we'll be doing that on daily, of almost an hourly basis, because we need each and everyone to get that information, to understand that everybody has got something to do about COVID-19. It's not about, they are not doing enough there, but it's about all of us as Zimbabweans to rally behind so that we manage to contain this COVID-19, and that will be done.
Now, Minister Moyo, obviously the health facilities that you mentioned, they are not standalones. The supporting infrastructure that is needed for them to actually thrive, the water reticulation system, power backup, and all the equipment that is needed, is that part of the plans, and also the ventilators?
Definitely, we don't want to end up with a situation where we have inadequate, facilities. So our facilities are going to be fully furnished. They're going to be well equipped, and we want to make sure that our partners move ahead of us, lead us, because they are bringing in the money. We'll work out the sketches, on how the infection control, will give them all the guidance on how the infection control has to be handled. We need gowning areas, for the protective gear, how you enter the room where the patient is, and then what we call the doffing process, which is when you are removing, the suits. It's like peeling off an onion, starting with the top until you get to the last, clothes that you would have been, the scrubs that you would have put in first. So all that, we want to create situations where each and every Zimbabwe can be able to access an efficient, well-equipped facility. We're not creating anything outside Wilkins which might be considered to be for the elite. Everything is for everyone. Any Zimbabwean who is sick can access, that facility from anywhere, wherever it is.
And when may we have them? Because maybe we don't have the time because of the, the propagation, the fast propagation of the coronavirus.
That's why we also have to work faster.
What are the timelines?
We can never, timelines, we wish we had finished by yesterday, but we have to collect the money. The people are coming in. Our supporters, our partners are coming in with the money, so as we get more money, we'll be able to move faster, and I can already see the zeal and energy which the private sector has. They want to start. We've given them the letters of support, so that they can be able to move in and be able to start, creating these facilities.
Now, Minister Mutsvangwa, the Special Interministerial Task Force on the coronavirus met for the greater part of today, like you mentioned.
Yes.
You've obviously mentioned some of the outcomes. What are the other key outcomes that came out of this?
I think what is important for you to understand is this is a crisis. We are almost in a war. We need to contain this situation. So there are committees, each one looking at the infrastructure, the fact that we've got enough isolation, makeshift isolation places, so that as I speak from all districts, like the minister has just said, we need makeshift isolation places where our people can actually go when they are not feeling well, even before they are diagnosed or they know that positively they are positive. So it's important that we have those makeshift isolation places. We also have got a team which is looking at communication, which actually is part of my interest, to make sure that we start sending out messages to all our chiefs, our headmen, and of course the media plays a big role, and our messages should be translated in both languages, in all the official languages of this country, because we want each and everybody to see. But like I said, we are not just going to concentrate on TV, newspapers, because we know there are certain areas where people may not have access to these. So this is why we are also using the local government structures and database, because they go all the way to the village. Because what we want is hygiene, to emphasize on the hygiene part of it, to keep washing your hands with soap, to make sure that you don't gather. Social gatherings should be completely banned, as the president has already given a statement on that, to make sure that people just don't move around unnecessarily. So these are the messages which we are actually putting across to our nation, that stay at home if you don't have anything important to walk out of your door for. So these messages, will continue doing them through jingles, through little plays on TV, especially for the children, so that they understand, wash your hands as often as you can, because this virus is actually deadly, and we want to prevent our children from...
Okay, Honourable Minister, thank you so much for that. I'll give you another opportunity to just give us an update on misinformation and the dangers of social media, and especially in this time. But we'll do that just after this short breather. You're watching the United Nations at 75 Dialogue, Shaping Our Future Together. You may have some advice for the United Nations. You can share your views actually online. UN75.online is the website, and this live broadcast is brought to you by Zimbabwe's TV network, ZTN, our partner, the United Nations in Zimbabwe, and our broadcast partners, Star FM, Capital FM, Nyami Nyami FM, Diamond FM, and also Herald Online. Not, of course, forgetting the Voice of America that will be rebroadcasting to over 80 channels globally. Remember, we'll also love to hear from you. Join this discussion on our Twitter handle, that's at ZTN News, and also on our Facebook page, Zimbabwe's TV network. We will be asking your questions to our panelists later on in the show. Join us after the break. Don't go away. Welcome back to tonight's discussion, United Nations at 75 Dialogue, Shaping Our Future Together. Now, in case you didn't know, you can get in touch with the United Nations Secretary General on United Nations, UN75.online. That's the website to share your thoughts. Tonight, we're focusing on SDG 3, which seeks to ensure healthy lives and promote well-being for all at all ages. And we pay particular attention to the coronavirus outbreak. We'd also like to thank our partner, the United Nations in Zimbabwe, and acknowledge our broadcast partners, Capital FM, Nyami Nyami FM, Star FM, Diamond FM, and Herald Online. ZTV is also beaming this live. Now, to our viewers online, you can join this conversation on our Twitter page, that's at ZTN News, and also on our Facebook page, Zimbabwe's TV network. Now, Minister Mutsvangwa, just before we went for the break, you were talking about the importance of information. Misinformation in a time like this, a crisis like you described it.
I must say, and I'm appealing to a lot of people out there, yes, we welcome social media. Information moves around very fast. We certainly want proper information being circulated. Of late, we've seen a lot of deadly information which can only promote our nation to panic. And we are saying that's not what we need. We don't need our people to panic. We need our people to have the right information. Let's not sit in a little corner. We all know that social media is borderless. I mean, somebody writes a Twitter from abroad or from a corner somewhere in Beitbridge or wherever you are. But we are saying, as Zimbabweans, as human beings, let's not circulate information which will cause loss of more people. We need to preserve life. And this is what we are saying. There is a lot of good information sometimes on social media. We obviously take information from World Health Organization and put it on social media, put it on groups, and people learn from that how to protect themselves, the hygiene which we are emphasizing, the social distancing which we are emphasizing. But there are some people who just put messages of scare which causes alarm and despondence, and we're appealing to those people that this is not the time. This is not the time. This is a big crisis. It's a threat. Covid-19 is a serious threat. We can't play around with lives. So let's circulate information which is helpful, which will save lives. And we are saying We know it's borderless. As a ministry, we constantly would be putting the right narrative, the right information. We rely heavily, we work very closely with the Ministry of Health and Childcare to just make sure that we've got the right information. As I said earlier on, we want to build trust with the nation. And by building trust, we will disclose what is happening. We will be transparent and, in giving information as it comes from the Ministry of Health. And this is what we're saying. This COVID-19, it's for all of us to put our hands on the deck. We need each and every Zimbabwean to work together and cooperate so that we save life.
The United Nations says leaving no one behind. That's part of our slogan as the SDGs. Now, Minister Moyo, Dr. Moyo.
Just add on to what she said. Social media, we have to behave ourselves, because this is a very serious situation, where you yourself who sits down to write that false information, you could also end up being a victim. In terms of epidemiology, we would like to be able to give our people the correct information so that we can be able to correct the situation. Now, if someone is there giving out the wrong information altogether, making people run in the wrong direction, yet, as epidemiology, in terms of epidemiology, we want them to move in this direction, and you make them scatter.
It doesn't help the situation.
It worsens the situation.
Now, Minister Mutsvangwa,
Actually, it's serious.
Yeah, very
Let
serious.
me give you an example. This afternoon, I was talking to a very close friend of mine. Her child was at a boarding school somewhere. And when she came back home, she said, "Mom, I'm not hugging you. I'm not saying hello to you, because we were told at school that everybody in Harare is infected."
You see the misinformation.
And this is misinformation.
Now, Minister Mutsvangwa did highlight the issue of speculation. I'm going to touch on this because Zimbabwe received its share of donated test kits and protective clothing from the Jack Ma Foundation. What is the plan for its distribution of this consignment? Because that speculative information, we did hear that some people are selling these kits on the street. How far true is this? That's
coming again through the social media. What would Jack Ma think about us if they suddenly hear that, kits are being sold on the streets? That is a total lie. The consignment arrived at Harare Airport, was met, by responsible ministers. The Deputy Minister of Foreign Affairs was there, and the trucks were directed straight to our warehouses at NatFarm. And as me and you are sitting here right now, all that equipment is being shipped to the various hospitals. As you heard, our personnel after the protective equipment. So we've made sure that immediately after arrival, it's unbundled and sent straight to the hospitals for use by our workers. So there is no equipment, there is no test kits that are being sold on the streets in Harare, which had come from this great donor, who gave us the Alibaba, Jack Ma. Everything is under control. I want to give the utmost assurance to the nation and to the international world and to the donor that the products that they send to us are going to be utilized effectively, and we are not going to allow anyone to pilfer, because we're taking a total stock of the products, and the use of the products is going to be well monitored. Whatever comes out will have to be noted in our computers. We've computerized our systems. Where they don't have computers, everything is being noted, and the pharmacy people are noting and distributing at the point of use.
Now, you did highlight the issue of protective clothing.
Yes.
Human resources in the medical sector seems to have been constrained in the past few years, looking at the doctor-to-population ratios. And we heard today that doctors and nurses are downing tools, especially for not having a PPE, the protective clothing. What is your comment?
Yes, I would like to assure all our health staff that the first priority that we have as a ministry and as government is to ensure that none of our health workers gets sick or gets infected, with with COVID-19, as a result, or while they are assisting patients, we want to make sure that they are well protected wherever they're working and whenever they're in contact with any patient. So we have made sure that, the equipment is distributed like I indicated. We want them to be back at work, and not to worry, because we are even getting some more protective equipment. This is a serious issue which we are taking more in a much more, we're taking it very, very seriously. We cannot joke about the lives of our nation, let alone of those who look after the sick.
Is government procuring more test kits?
And we are getting more test kits. As we indicated, the budget has been worked out, to now 100 million, and the money that we are getting from the Ministry of Finance, we are putting the majority of the money towards the protective kits. So we want our people, our health workers, to be well looked after, and we shall continue looking after them. And if I could add on, we've actually decided, the government has decided that they should get a risk allowance. A COVID risk allowance is necessary for all those healthcare workers, who are providing this service.
Do we have a figure?
Directly.
Do we have a figure on that, Minister?
The figures are being worked by the associations and our Health Services Board, but it will be a substantial amount, in order to make sure that they continue to provide the service. And at the same time, we're also looking at the other health-specific allowances.
Have they been trained, especially on handling COVID?
Yes, that is the next thing that we're talking about. We've been training our personnel, right? We've called most of our senior personnel to come to the training of trainers course at the Wilkins Hospital. And they've gone back and they are disseminating the information, to the other health workers. And we've also called upon the various medical associations under the ambit of ZIMA, Zimbabwe Medical Association, to conduct training courses. Right as we are speaking, we had workshops at the University of Zimbabwe, and they are cascading to Bulawayo, and we want to be able to train all the nurses. All the nurses have to be trained. It's a large number, and it's going to be a continuous process of training. The training will not stop just because, we've trained 50, because we need to train at least 16,000 nurses.
And the challenges are also dynamic.
And the challenges are also dynamic.
Minister
and
Mutsvangwa,
part of the funds, which we have put together, involve a lot of the training aspects.
Minister Mutsvangwa, I just want you to come in on the issue of stigma. I know it can be detrimental in handling any disease or any condition. What steps have been taken to try and reduce the impact of stigma?
Actually, the training he's talking about plays a big role in COVID-19. And we are here, he was talking about training the health practitioners, but we are also talking about training the police. Anybody can collapse right in the middle of the road, and we know that the police have got to deal with them. So we are actually talking about training those who will be involved as we tackle this crisis. So the training will certainly play a very, very central role. And when it comes to stigma, we don't know who is positive until they are tested. And this is why we are concentrating as a task force. Issues of testing kits are very central. Issues of isolation, makeshift areas are very, very central. Issues of protective clothing, because we really want our nurses and our doctors to be well protected, because those are the people who are saving our people's lives. And if they are not protected, it means we are exposing them. So, and then also the training of police will obviously be handling those who may, if anything happens in the streets or whatever. But here we are saying to Zimbabweans, this is a crisis. We need to sit back and think about all the precautions which World Health Organization are talking about, which other countries which have successfully contained this disease have done. We do not need to send messages of panic, and I repeat again, we need to give people information which will make this disease be contained. And there's no need to stigmatize people just because he has coughed. We've always had flus.
We just need to change the mindset of the general populace.
We need to change the mindset of the whole populace.
Now, Dr. Moyo,
yes.
there are reports of elite facilities for those that are more privileged. There goes that social media again. Do you have any comment on that?
Like I indicated earlier on, you know, there's no such thing as facilities for the elite. You know, however, if a private hospital decides that they would like to put up an isolation center, you know, at their hospital, that is their own prerogative. You know, the private sector has always had candidates, you know, whom they look after. But if they want to go the extra dimension...
Does that not contradict, does that not you know, compromise the issue of safety and standard, biosafety standards?
Yes, exactly. That's the next point which I'm going to make. You know, they would have to follow the laid down procedures for infectious diseases. You know, we don't want anyone to wake up and put up, you know, a facility, you know, where they would be looking after infectious patients when next door, you know, they've got clean patients.
Are there any private players that have approached the ministry today?
No, not at the moment. No, not at the moment. But, you know, we want to encourage them to put up separate, you know, facilities rather than within, you know, their existing facilities, because it will
cater for their normal patients.
Yeah, can cater for their normal patients.
Minister Mutsvangwa,
I think it's only normal that anything which is going to be happening will be centralized from the Ministry of Health point of view. So all these makeshifts, I haven't had any. But when you ask the question if there are any private companies, in fact, the private companies who have already come on board are saying they want to help government to make sure that they also help in terms of procuring ventilators. Maybe those with free funds, they can actually bring ventilators from outside. I was about to say,
those that have the facilities, can they go ahead? And then
so strictly as government, we have no segregation. You know, whatever facilities that government puts up, anyone can use them. Yeah.
Now, Minister Mutsvangwa, have we done enough to drive home the importance of social distancing, especially in light of our culture? We are people that love to greet each other a lot. We seem to have done a lot in terms of sanitizing our hands, but social distancing seems to be lagging behind.
Let me say, this is not an event, it's a process, and it has to go very, very fast because we are confronted with a crisis. I know people have got this habit of handshaking, and we're saying no. And people have got to quickly, this is why the messaging, and we are giving media briefing all the time to make sure that each and everyone understand the need of quickly withdrawing from what they are used to. That culture of embracing each other, of kissing, of whatever, that is what we are discouraging. And we need our people to quickly move away from doing that, because that is disastrous, that will actually kill a lot of our people. And this is why we are saying we need to take those precautions so that we save lives.
Well, is there anything that we are doing in terms of enforcement? What's the position as government?
Well, we're looking, the task force is actually looking at all those things, the involvement of if we need police to come in and help in certain areas to make sure. But what is important is I earlier on talked about involvement of traditional leaders, religious leaders, because, you know, as we are going towards Easter, a lot more churches want to gather, and so this message is actually going out there. And, you know, our president is always engaged with religious leaders, traditional leaders, and we continue to use those channels to make sure that they understand that whatever we are doing at this point in time, let's not go to gatherings. We can pray from our homes for now to save life. We cannot continue to go to these big gatherings because that's where the virus will actually move very, very fast. So we'll continue talking to our traditional leaders, our religious leaders, and even the youth, the young people, so that at least everybody comes on board.
Dr. Moyo, you've got the issue of best practices. I know Minister Mutsvangwa did hint a bit on that. What are some of the lessons that Zimbabwe has taken from those nations that have dealt with the outbreak since it started in December to actually take on board and implement?
Well, the issue of the situation that we have right now, if I may compare with the cholera epidemic, it was localized in Zimbabwe, right? And then we quickly identified the epicenter as Glenview. We cordoned off Glenview, identified the actual source of the contamination. And we found that there were wells within that area which were contaminated. And then we moved forward to ensure that, we would contact trace, people who had moved from that area, made sure that they were also isolated wherever they were and got the appropriate treatment. Now with this COVID, the cases that we have, we've got 3 cases so far, and our COVID-19 is an imported COVID-19, which means it came through our borders. So it is very essential that we control our borders. That's why the President enunciated that, the borders would be closed so that we monitor whoever, the few numbers that would now be coming in more intensely and be able to rule out. And so that, if we have fewer numbers coming in, we can be able to follow them up as we do the surveillance, check their temperatures on a continuous basis during the quarantine period. So that is what we have to do. So the borders and within, we do not want the spread, to increase within. Mm-hmm. We had 3 at the moment. We want to be able to make sure that, the numbers don't increase, mm-hmm. Rapidly. Mm-hmm. So that's why we have these surveillance teams. Whenever there's something, they are there. The rapid response team, they come in very fast.
And they gather all the information in time.
Gather all the information, do the clinical examination, check if the afflicted are in line with the clinical definition, WHO clinical definition, and then upgrade them to the next level of the clinical management.
Minister Mutsvangwa, now the issue of the employee's safety, we talked a little bit about that. But in terms of labor protection and also livelihoods, how do we balance now the issue of enforcement and economic activity? Because people need to survive.
Certainly people need to survive, and we are a poor country, we know that, and a lot of our people are actually in informal sector. But these are the issues which the task force are all looking at. And but at the same time, also we want our people to live. We don't want our people to die. So this is one thing we have to balance out and see how we can do it. Otherwise, social distancing is important if we've got to contain this disease. Well, certainly the task force, as I speak right now, is actually working on that and working on the logistics of how we go about it. But we can't run away from it. This disease requires that we've got social distancing, requires even employees. Our employees' well-being is very, very important. And this is why a lot of ministries are already looking at skeleton employees, so that at least those essential ones who are required at that particular time, they are in the office, because we want to make sure that there are people who are saving those who need to be saved.
That's very true.
Yes.
Life goes on. Thank you so much, Honourable Minister. We'll be taking a short breather, but you are watching the United Nations at 75 Dialogue, a decade of action on SDGs, shaping our future together. Share your thoughts and complete our online survey. That's at un75.online, www.un75.online. UN75.online to give your thoughts to the United Nations Secretary General and fill in that online survey. Tonight we discuss SDG 3, which seeks to ensure healthy lives and promote well-being for all at all ages, and we pay particular attention to the coronavirus outbreak. This live broadcast being brought to you by Zimbabwe's TV network, our partners the United Nations in Zimbabwe, and our broadcast partners Star FM, Capital FM, Nyami Nyami FM and Diamond FM, as well as ZBC. Remember to give us your feedback through our Twitter page, that's at ZTN News, and also on our Facebook page, Zimbabwe's TV network. We will be giving your questions through to our panel just after this short break. Don't go away. Welcome back to tonight's discussion. United Nations at 75 Dialogue, Shaping Our Future Together. Tell the United Nations Secretary General how you want to shape the world. That's on UN75.online. We would also like to thank our partner, the United Nations in Zimbabwe, and acknowledge our broadcast partners, Star FM, Capital FM, Nyami Nyami FM, Herald Online, and Diamond FM. Not forgetting, of course, the Zimbabwe Broadcasting Corporation and the Voice of America that will be rebroadcasting to over 80 channels globally. Also to thank our viewers joining this discussion online on our Twitter handle, that's at ZTN News, and also on our Facebook page, Zimpapers TV Network. Thank you for sharing your thoughts with us. In this segment, we get to hear from you, our viewer, and I have a few questions that we will extend to our panel. But just to give a shout out to those that are tuned in, Sheila Chikoki in Cape Town, Sikefula in Marondera, T. Muringani, you gave us your Twitter handle at Radebe94, at ZPB Dro, Shanice, Dr. Muchi is also online. Thank you so much for joining us online. Now we ask our question to our panelists. Now, this question says, is there any reason why the state seems not to have the requisite measures in place in terms of equipment and the likes? This is T. Muringani. He believes that maybe the government is not doing enough.
Yes, as we've been saying all along, we are not an economy that can compare with China or the United States, let alone to look after such a pandemic condition, right? So we are trying our best with the meager resources that we have. And at the same time, with the help of our partners. The United Nations are all good partners. They have given us assistance. So the Ministry of Health and Child Care is doing all it can in line with the level of resources that we have available.
Still on resources, Honourable Minister, have we received anything from the United Nations and its partners so far to date?
We have resources earmarked for us, from the UN Global Fund. Right, Global Fund is going to give us $25 million US. As soon as that money arrives, we will naturally be able to utilize it to spruce up our facilities, to come up, with these makeshift isolation facilities, and be able to look after our staff and things like that, and be able to equip, the units, the equipment that we need. It will come from those funds. But I have to hasten to say again, the government of Zimbabwe itself has made its own local contribution, and those are the funds we are currently utilizing to replenish our supplies, especially what we require urgently right now being the protective equipment for all our healthcare workers, plus also the other workers, who are in essential services. Yeah.
I just wanted to add something. The government of Zimbabwe is very much concerned about making sure that we contain COVID-19. But we should always bear in mind the government of Zimbabwe is confronted with many other problems which have confronted this country in the last 3-4 years, without talking much about sanctions, which are illegal sanctions imposed on this country. But talk about, we've had 3 successive droughts in this country, to the point where now government is taking money which is meant for other things or development of infrastructure to make sure that we import the necessary maize so that our people don't die of hunger. That's a serious problem. Last year we were confronted by this calamity, the cyclone Idai, again where the government had to take resources which were meant for other things to make sure that we give back the livelihood of the people of Chimanimani, and that has not even been complete. We still have a lot of work to be done in Chimanimani. Lots of people have not been relocated. So we are saying with those Miaga resources, the importance of this COVID-19 cannot be overemphasized. And this is why I'm saying the Ministry of Finance is actually doing everything under its what it can do to make sure that at least there's some resources put to make sure that we save lives.
We need to move on to the next question. This is coming from Shanice, are there any measures being taken to have mobile teams that conduct tests for COVID? Because at the moment, you may have symptoms, but the only way to get tested is probably traveling and public transport. And he says Kuenda Hospital, which is also a risk to other people. I think this point really says, can we be more proactive than to react to the symptoms?
Yes, definitely. Like we also indicated, at the moment, the testing scheme that we have, only takes about 5 hours. It's a very specialized format of testing.
That's the PCR.
That's the PCR. We are waiting our rapid test kits. Once the rapid test kits come, we'll be able to distribute them countrywide.
The test kits that we got from JECMA, are they rapid tests?
No, these are PCR.
Oh, okay.
They gave us 20,000 PCR. And we have the platforms, for utilizing those kits. They need to do what they call extraction. You have to extract the sample.
And process the DNA.
And then process the DNA, and then you amplify it so that you can be able to determine the number of copies of DNA in the sample. If it's positive, you'll have a huge peak. If it's negative, it's just a flat peak.
We've had the task force being quite active, looking at contact tracing for these cases that we have. How many tests have we conducted so far, and how many people maybe are under surveillance right now under the task force?
Well, in terms of surveillance, there's two aspects. We've got the aspect relating to people who came in through our borders, who are being followed for their 21 days. And those numbers reduce as the number of people coming in the country also reduces, right? And then there is the issue relating to those who are being tested. You know, the numbers continuously increase, you know, and they've increased, you know, especially after we realized that, you know, some of our COVID positive patients might have met contacts. So naturally, as part of contact tracing, we've got to be able to reach to those individuals and be able to subject them to a testing procedure. And most of them have also been presenting on their own after they realize that they've been in contact with someone who is positive out of the 3 candidates that we have. You know, so those numbers will vary on a daily basis. You know, you know, in future we'll be able to actually give statistics of the number of cases that we have, the number of confirmed cases, the number of suspects, you know, and so on. And we want to create a nice reporting system so that on any one day, on one particular day, we can be able to know exactly what has happened in Zimbabwe, what has transpired in Zimbabwe.
Thank you, Dr. Moyo. Now, Minister Mutsvangwa, Dr. T. Muchi says, how many centers are ready for COVID-19 and how much of people is allocated for each district and province? Probably that's for Minister Moyo, but this is the point where I want you to come in. When is government going to consider total lockdown, considering the unpreparedness of our health system to handle cases? He's asking for a lockdown.
Like I said, the task force has been sitting since yesterday, and they're still sitting now. They have got a mandate, their terms of reference, and they've got to report to the president of the country. And this information will be coming back to you. But like I said, we all agree that social distancing is a very, very important thing in containing this COVID-19. And you know that schools already have been closed. And I was talking about skeleton staff in our workplaces. So there's a lot more which will be coming. And the task force is sitting as I speak. And we'll be soon giving you the information on that one.
Minister Moyo, this is Bele Dube. And he or she says, how is he going to account for Jack Ma's donation? We need transparency also in the new, he mentions the name, they are going to get the donation to a prominent figure. Are the prominent figures going to get part of the donation?
What do they mean by that?
I don't know, maybe for their own testing and convenience. He says, how is he going to account for the Jack Ma's donation? We need transparency. He's asking for that assurance.
Yes.
I think the Second Republic has been very transparent. I think this is also what Zimbabweans should look at. The Second Republic has been transparent. The new initiative of even giving back, what Cabinet would have discussed. Right now we are talking about the task force, which is sitting, and we will be giving you all that information. Everything will be done transparently. It is important to save each and every life. Every life matters in this country. This is our Zimbabwe together. There's nobody who is more special than the other. I think once as Zimbabweans we start taking that out of our mind to say there are other people who are more important than the other. There's no one who is more important than the other. We do not want to lose even one life. And whatever efforts which are being put into place to contain this COVID-19 is to make sure that we save each and everybody's life. This is why we are even talking about our people in the rural areas, in grassroots, all the way to Machonyonyo. It's important. We need that life. So there's no special arrangement which is being done for special people. There's, in any case, let's take it out of our heads. There's nobody special in this country. If it was a company, we are all equal shareholders to Zimbabwe.
Yes. Let me just talk about those supplies which came from Jack Ma. We know that there was 20,000 test kits. Those test kits were moved straight, to our minus 20 degrees centigrade freezers. And those freezers are well manned. Whatever comes out has to be documented. right? And we have auditors who can do the checks at any time. Everything that came out was deposited, at the National Medical Microbiology Reference Laboratory, right? And any sample that has to be tested is noted, and we know that. The controls which are used are also noted, and we know that. So at the end of the day, we count just like we have the systems, or the point of care, point of what? On the tills. Isn't it? They enter all the stocks.
Point of purchase.
Point of sale.
Yes, point of sale. They enter all that information into the what? Into the computers.
So it's recorded in and out.
And then when they come out, it's recorded.
Now,
so we are recording all that.
20,000.
And at the end of the day, there is always the auditors who can do the audit.
20,000 kits. How long can that last us? How many tests are we doing per day?
Well, 20,000 kits, for the PCR is quite a lot of kits, right? If it was for the rapids, it would not be many. What we want to aim for, really, is to get more of the rapid test kits. If we can get 1 million at a time, then we can just voluntarily have people coming in for the tests. 20,000 test kits will last at 20,000 people tested. That's the time frame.
What are the numbers? How many people are we testing?
Well, to give you an example, yesterday we tested 15.
15 people.
Yeah, 15 people.
Okay.
That's to give you a rough idea.
That's coming from the contact tracing.
Yeah, just coming from the contacts. But as obviously as the contacts, numbers of the contacts reduce, we'll also have less tests being done. And like I said, this is a very tedious test. For the lab to be doing 15, it's a lot of time taken. That is why we now want to utilize other centers, like in Bulawayo. We want to use NAST University. They've got the equipment, the PCR equipment. So all we have to do is to give them those kits. And when we are giving them those kits, we will also make a note. They will sign for them, and we will make sure that if they did 20 people, 20 kits would have been moved out.
I think that point is clear. The government officials that we hear were probably exposed to one of the victims of the coronavirus. Has precaution been taken? Have they been tested?
Which ones?
Reportedly, we heard that one of the victims was in contact with a number of government officials.
Okay. No, those are being followed up, and we're making sure that you don't rush to do the test. There's some who wanted to have the test done. They were done. And in actual fact, the 15, were part of the contacts, right? But we don't want to rush to have the test done, because the client has to build adequate antibodies in their body, right? And that's when the tests are able to pick up the number of antibodies, because the test actually picks up the number of antibodies. As you have an infection in your body, you will have more soldiers coming to fight that infection, and the soldiers are the antibodies, and that is what we pick up, when you do the test.
Zimbabwe's managed to get just 3 cases, and we wish that the numbers stay low. But if we were to get maybe 10, 12 cases, taking into consideration the number of contact tracing, do we have the capacity to actually get in and get to the bottom of the problem?
This is why we are preparing on a daily basis. We had the pre-case period. When I say pre-case period, I mean before we had a case, before we had our first case in Victoria Falls. That was preparatory, a preparatory phase, where we were now looking at the borders, people arriving at the airports, the thermal detection, that is what we were doing, the screening processes. We were just looking at that mostly, and putting up, the facilities. Like I said, Wilkins Hospital, the Parliamentary Portfolio Committee went to see it as well, and then we moved into the next phase. This was the phase after we had our first case. which meant that, we now had to ensure that we have adequate isolation facilities. And unfortunately, our friends, the Chinese, they came to help us at Wilkins and so on and so on.
We need to
so
wrap
the
up,
the next phase is that of expansion. We now have cases, so we must expand, and it has to be countrywide. We don't wait for the number of cases to increase, but we expand and increase the number of facilities in case. But at the same
Maybe in
time,
the next 3 weeks?
No, at the same time, it's not our hope, that, we get more cases. So what we are doing is to make sure that we contain the problem on a continuous basis.
Minister.
But if it's about talking about the makeshift, as I was talking to you earlier on, we've got capacity in the country, and I was telling you about our higher Institute of Learning, universities, which are capable of actually building this makeshift infrastructure for isolation facilities. And we will certainly be seeing that work being done as quickly as possible. That doesn't require foreign currency. It is, and the Ministry of Treasury is ready to make sure that funding and also even sanitizers, as we talk of precaution, we have also realized that there's a lot of our institutes out there who can actually manufacture sanitizers. And so this is what we are saying about precaution. And just also to say to the people of this country, from what we are learning, I think there's 85% recovery rate. One of our victim in Victoria Falls actually is actually recovered. The Minister of Health can actually concur to that yet. Yeah. So this is also something which we are saying, let's just do the precautions as World Health Organization and also the ministry and many other countries who have successfully contained this disease. Let's do that. Let's wash our hands all the time. Let's make sure we stay at home. Just go out when it's really, really necessary. Otherwise, if we do that, we'll be able to save our lives.
Key points there that you raise, Honourable Minister. I'll give Dr. Moyo a chance to also give us your parting shot, and then we can close.
Yeah, no, but before I do that, I want to add on to what she says with regards to the patient in Victoria Falls.
Very quickly,
they are self-isolated, and they are very stable. So it can be done also from home if you are disciplined. And at the same time, I want to also say that those who have got comorbidities, like people who have heart problem and things like that, those are the ones who would need additional support with equipment like ventilation equipment. So that's the situation. So as a parting shot, I want to say, as Zimbabwe, we are working flat out and making sure that whatever we do will be able to assist our population. We are working in such a manner that we want to try and avoid the increase exponential. We don't want an exponential increase in the number of cases who end up with COVID-19. So we are making sure that everything that we do it in an honest manner, and we want to discourage, the social media from flaming the situation and making the whole working scenario very difficult, in terms of us trying to control the situation. I also want to indicate that we are going to make sure that we look after our staff who are going to treat the patients, who are going to give all the care to the patients. To me, that is a critical factor. Without our healthcare personnel, without the essential services providers like the police, the army, and everyone, we will be in a quandary. So we want to look after everyone who is involved, and our partners. We want to be very grateful for what they are doing for us. As a poor country, the partners already stepped in a big way, and the United Nations, I want to thank you very much, the World Health Organization, for what you've done for us. The assistance in terms of guidelines on a daily basis, working with us, identification of some of the initial protective equipment that they've given us, and making sure that the rest of the partners, work with us, in a holistic manner.
Thank you so much, Dr. Moyo. In a few words.
I just wanted to say
in 15
to
seconds.
Zimbabweans, rely on official information. We are open, our doors are open to all of you. We are on Twitter as a Ministry of Information. ZBC will be continuously giving you media briefings, regular ones, updating you information as it comes through from the Ministry of Health. So please rely on official information. Let's not panic. Let's work together to contain this disease.
Thank you so much, Honourable Minister. Unfortunately, we've run out of time. Unless if it's just 5 words.
Yes, 5 words. Don't forget to continuously wash your hands. Stop greeting each other. Stop the handshake. You know, and always make sure that you cover your nose and mouth when you're about to sneeze or use your elbow. And the greeting fashion, you mustn't change. Let's have that change of behavior and be able to control COVID-19.
Thank you so much, Honourable Minister. Dr. Moyo, thank you so much for coming to the show. Minister Mutsvangwa, I have to thank you so much for that wonderful insights that you did make.
Thank you, Blessing.
Now, to close our show, here's a quote from Antonio Guterres, the United Nations Secretary General. The 2030 Agenda and Sustainable Development Goals, the SDGs, our collective response to build a fair globalization. In implementing the SDGs, no one is left behind. A call to inclusive and a collaborative effort from the United Nations Secretary General, whom you can also get in touch with by visiting un75.online today. I would like to thank our partner, the United Nations in Zimbabwe, and also acknowledge our broadcast partners, Herald Online, Star FM, Capitalk FM, Nyami Nyami FM, and Diamond FM, the Zimbabwe Broadcasting Corporation, and Voice of America that will be rebroadcasting to over 80 stations globally. My name is Blessing Manasi. Do stay great and be safe. Good night.